Hello all, this is Dr. Siri. I'm pursuing my Masters in Dental Surgery in the subject of Conservative Dentistry and Endodontics at Sri Hasnamba Dental College and Hospital, Hassan, Karnataka. I'm so glad to be part of Save the Tooth campaign conducted by DentistChannel.Online. So today I'm here to talk about first aid in dental emergency. So I'm going to discuss about a few of the conditions in dentistry which can be addressed in certain way when the patient is unable to approach to a dentist at that particular point of time. So starting with toothache. Toothache is a very general problem encountered by most of the patients. So toothache suddenly occurs at night and you're unable to visit a dentist. So what to do? So in such conditions, when there is toothache, it is usually associated with deep caries lesion, that is a deep decay in the tooth where there is loss of tooth structure. So it is a site where food debris can go and get lodged and it can aggravate the pain. So in such cases, it is always recommended to clean the mouth with water and flush out the debris which is lodged in the decay or the carious tooth. Apart from this, if there is caries in between the two tooth structure, in such cases, whatever material that gets lodged between the tooth which cannot be removed by the normal brushing, it can be removed with the help of interdental brushes or floss. So these are some of the tips which can be done when you have a toothache and you're unable to visit a dentist. But it is always recommended to visit a dentist as early as possible after the initiation of toothache. Next, coming to orthodontic emergencies, that is problems with braces and retainers. So in such cases, what is the most encountered problem is protruding wire, that is the braces. A wire from the braces protrudes and it causes irritation. So in such cases, patients can keep a cotton ball, a small cotton ball or a piece of gauze to protect the soft tissues of the mouth. So this is one of the tips. Apart from this, if a wire gets stuck in the cheek, do not attempt to remove it. You have to go to a dentist immediately. And if any appliances that is given by the dentist in the mouth and if it is loose or a piece of it breaks off, place the appliance and the piece in a clean container and advise the parents to take their kids, or if it is an adult, it is very important that to visit a dentist as early as possible. So coming to the next condition, that is bitten lip or tongue. So this condition usually occurs in children or it occurs in adults when the patient has undergone any extraction of the teeth and due to the anesthesia action, there is still anesthesia which is acting and the patient unknowingly bites the tongue or lips. So in such condition, what to do? So when the patient has bitten his lip or tongue and if there is any bleeding from the area, it is very important to apply direct pressure on the site of bleeding area with a clean cloth. Apart from this, if the swelling still remains, so it is important to give cold compress. If bleeding doesn't stop within 15 minutes, so in such situation, it is very important that the person has to go and visit a dentist. So this is some of the first aid in case of bitten lip or tongue. Now coming to next condition, which is chipped or broken teeth. So in such cases, we have to gently clean the dirt from the injured area with warm water. After that, the tooth should be protected from further exposure to air or liquid or cold liquid because it can lead to sensitivity in this patient. So it is important to cover the site, that is the tooth which has been injured, with the sterile gauze or cotton ball. Apart from this, cold compress should be placed in the site over the face in the area of injured tooth in order to decrease the swelling. And if there is any obvious exposed nerve, it is very advisable to meet the dentist as early as possible. So this is in case of a chipped or broken teeth. Now coming to knocked out teeth. So in some cases where the children are playing and the child falls and the tooth falls out, or else in case of any accidental injuries and the tooth falls out, and if you are able to locate the teeth, you have to immediately locate the teeth and handle the tooth with the tip of the crown, that is tip of the teeth, and you should not touch the root portion of the teeth. If the tooth cannot be found, look into the mouth area where the tooth should be. Should be make sure that it is not driven into the soft tissues or into the esophagus. Next tip is, if the tooth can be located and it is dirty, rinse it gently under running tap water. After that, the tooth or the root portion, the crown or the root portion of the teeth shouldn't be scrubbed. To remove any of the fragments. Place the tooth in a cup of milk, that is usually recommended, and then it should be carried to the dentist immediately as possible in order to replace the tooth back. So it is advisable to visit a dentist after knocked out tooth within 30 minutes if possible, because time is a critical factor in saving the tooth. Remember to take the tooth along with the patient when you visit a dentist, because if it is taken early, it is possible to replant the tooth in the mouth of the patient. So these are few of the conditions where first aid treatment can be given to such dental emergency conditions. So these are few of the tips. Thank you for this opportunity. Thank you.